Hello guys, it's Miles here from Peak Metabolism. Thank you for tuning in. This is the first of many videos we'll be doing talking about cardiometabolic health and what markers you should be looking at, what lifestyle interventions you should be doing. And first things first, we're going to look at one biomarker, the fasting blood glucose level, and what you should be looking for optimizing your blood glucose regulation. Now, this is one of the most common tests which are done by doctors, and it's normally indicative when you are getting over 120 mg per dl or close to that level, that a doctor would intervene and say, you're diabetic, you're close to being diabetic, let's repeat that test once again and let's be sure, and then you probably get a diagnosis of being diabetic. Now, what we do know is that diabetes is a linear progressive disease which happens many years before you get diagnosed. And what we need to be looking at is the research indicating and telling us that we should be looking at the markers of fasting blood glucose in a more nuanced manner. So the research is saying in the American Journal of Medicine that if your blood glucose levels at fasting are 95 or higher, you're 3 times more likely to be developing diabetes. And another study has shown if your blood glucose levels are 85 per mg per dl or higher, you are much greater risk of developing cardiovascular disease. So what these research studies have shown is we need to bring the reference range much lower to intervene and change our lifestyle accordingly so we can keep that blood sugar nice and sweet at around 85 or lower. And so this is the best intervention we can do when just using the fasting blood glucose test. Now, there is another way we can use the glucose test to help us manage our blood sugar regulation, and that is when you do a postprandial glucose test. So that's a 2-hour post-eating test, and when you do this test, you want to see your levels around 130 mg per dl or lower, and that is a great indicator that you're regulating your blood sugar really well, and that meal you just had was a good choice in keeping your carbohydrates at the level it is at. Some people respond to the same foods differently, and this is why the postprandial glucose test is much more sensitive than doing a fasting blood glucose. So there you are, guys. Just focus on getting to 85 mg per dl. That is the magic marker we want to be getting to. If you have any further questions, please put your questions below and I'll help to answer them. Have a good day.